Many people who are looking for birth control come to me and ask, is an IUD right for them? Today we're going to talk about the basics of IUDs and help you figure that out. IUD stands for intrauterine device, and it's a type of birth control that's inserted into the uterus. There are a couple types of IUDs, but the overall concept is that the IUD stays in place for many years and provides very effective birth control. It can also be used for emergency contraception when placed within 5 days of unprotected sex. IUDs can last for many years, but the duration really depends on what type of IUD you have. Hormonal IUDs can last anywhere from 3, 5, or 7 years, and copper IUDs can last up to 10 years. Keep in mind, those are timelines that are approved by the FDA, but many people find benefits beyond those timeframes. There are many benefits to IUDs if an IUD is right for you. They're cost-effective and low maintenance because they only require a single insertion and then stay in place for years. Many people also wish to avoid hormonal birth control, and so an IUD really has most of its effects around the uterus and doesn't really impact the rest of the body. IUDs that are higher in hormones may have some benefit on periods as well. Specifically, some people find that their cramps are improved and they lose less period blood with a hormonal IUD. One of the biggest negative aspects of an IUD is that it requires insertion by a trained medical professional. IUDs may also be a little bit painful with the insertion process, but that resolves very quickly. Other negative aspects of the IUD are usually temporary. Many people experience spotting or changes in their menstrual bleeding pattern in the first 3 to 6 months after having the IUD inserted. The copper IUD in particular is well known to cause some problems with heavier cramping and heavier bleeding, especially in the first 6 months after having it placed. The procedure of getting an IUD inserted is actually pretty simple. It's very much like a pap smear. The medical provider starts by inserting a speculum into the vagina, like a pap smear. Then the cervix is visualized, and we clean the cervix off with a special type of medicine. The next step is inserting the IUD, and that's about it. The whole procedure takes about 5 minutes. Some of the side effects that you might experience include a little bit of cramping that can last the rest of the day or so. Some doctors may also give you a pain medicine and a medicine that reduces cramps before you go in for the procedure, or they might ask you if you want something after the procedure. But most effects are temporary and should resolve within 24 hours. Most people keep their periods when they have an IUD. Benefits of a hormonal IUD can include reduced cramping and reduced period blood loss, but most people do continue to have a period with an IUD. Like all forms of birth control, an IUD is not perfect, but it is one of the best options when it comes to protection from pregnancy. The pregnancy risk is well below 1%, but it is still possible to become pregnant with an IUD. If you want to learn more about your body or sex, subscribe to our channel. And if you have any questions for us, leave it in the comment section below. Thanks for watching.